Hello guys, welcome to the NEET PG 2021 pattern MCQs. So this question is actually a young man who is seen over a 5-year period with several episodes of unilateral elevation of intraocular pressure, and this elevation is quite high, 40 to 50 mm. During these episodes, we have fine keratic precipitates, faint flare, mild ciliary flush. Now, a very important thing, no iris changes. Each episode is responding well to the topical corticosteroids and the topical and systemic aqueous suppression, and they are asking you the most likely cause of this episodic glaucoma. So, if you concentrate on this question, they have already given you that this is a case of episodic glaucoma. So, you can actually rule out those conditions which are not associated with glaucoma and look at the age of the patient, the gender of the patient, look at the keratic precipitates. Now, you know that KPs are actually pathognomic of the anterior uveitis. So, you will have to actually look at a condition where you have episodic glaucoma associated with uveitis in a young male and which is responding well to the topical corticosteroids. Now, let us see options one by one. Your option number 1 is the Fuchs heterochromic iridocyclitis. Iridocyclitis. Now, this Fuchs heterochromic iridocyclitis is again a condition where you have iridocyclitis. That means you have got uveitis, and this leads to the unilateral elevation of intraocular pressure. That is, your episodic glaucoma is there, but this condition is more common in females, number 1. Second important thing, you have got iris changes. Its name is heterochromic iridocyclitis. So one of the peculiar changes that you get in this case is your heterochromia of the iris, and the affected eye is lighter colored. You have got rubeosis iridis, you have got atrophic patches, while posterior synecdoche are always absent. So if they are telling you about a case of Fuchs heterochromic iridocyclitis, they will tell you the changes most probably occurring in a female, middle-aged female, fine stellate KPs, grey colored, where you have got a lot of iris changes, lighter colored iris, you have got iris nodules, you have got rubeosis iridis, atrophic patches, and you have got posterior synecdoche always absent. Yes, so that means it is very unlikely that this is a case of Fuchs heterochromic iridocyclitis, because they have clearly mentioned that you do not have any iris changes. Coming to option number 2, juvenile rheumatoid arthritis. Now, if I talk about juvenile rheumatoid arthritis, also called as the juvenile chronic arthritis, first of all, this is occurring in less than 16 years. Now, this is a condition where you are having uveitis along with arthritis. Okay, it is the arthropathy where you are also having the uveitis, seropositive, seronegative, as well as the Still's disease. Here you are not having the episodic glaucoma, right? So again, you are not thinking in terms of juvenile rheumatoid arthritis. Coming to the Posner-Schlossman syndrome, so you will come back to it. Then you have got the sarcoidosis. Now, if you talk about the sarcoidosis, definitely it has uveitis. Okay, it is one of the systemic disease where you can have uveitis. This uveitis where you have got, pan-uveitis, you have got the granulomatous pan-uveitis, and out of this pan-uveitis, which is most important, that is your pars planitis. So basically, when I talk about the sarcoidosis, I am talking about the granulomatous pan-uveitis. You have got candle wax drippings, you have got the nodules, you have got the pre-retinal nodules, that is called as a Lender's sign, breathlessness, snow banking, snowball opacities, patient having a multiple gland involvement, Mikulicz syndrome, we have got the dry eyes, all these things. And we are not talking about the glaucoma per se, because we have got the retinal vasculitis. So by the diagnosis of exclusion also, your answer is Posner-Schlossman syndrome. Now coming to this syndrome specifically, this is glaucomatocyclitic crisis. What is the other name? The other name is glaucomatocyclitic crisis is there, where you have glaucoma as well as cyclitic. So this is a case where you have episodic glaucoma, unilateral, which is more common in males. And here the important thing is that though the intraocular pressure is high, the eye is white. eye is white, you do not have any congestion, because why glaucoma is occurring here? Due to the trabeculitis. You have got inflammation in the trabecular meshwork. So there is no congestion actually, there is no narrowing of the angle. You have got inflammation which is leading to the blockade at the trabecular meshwork because of lot of inflammation, and usually it is on one side, that is leading to glaucoma. So this is ideally a case of Postner-Schlossman syndrome, also called as glaucomatocyclitic crisis. Then the important features of Fuchs uveitis syndrome along with juvenile rheumatoid arthritis and sarcoidosis. See, there are two ways of solving a question. Whenever you are having a clinical question, there are two ways to solve it. Either you directly know the signs and symptoms of this disease and you are marking it. Now this will be helping you in less than 50% of the cases, because clinically some of the symptoms always do overlap. So you just cannot say that all these things means this syndrome is equal to. So that there is nothing like that, and you always have overlap in clinics. So the other important thing which will be applicable in more than 50 to 60% cases is your diagnosis of exclusion. If you have this cannot be there. If you have this, then this cannot be there. If sarcoidosis, then this has to be there, because every disease has certain pathognomic signs and symptoms without which you cannot diagnose it. Like if I want to diagnose the iridocyclitis, I require KPs, flare, inflammation, circumcorneal congestion. Without that, I cannot diagnose it. So I think this is the most important way of and very useful way of getting the right answer, and you can sometimes get to the answer where you do not know. Like in this question, even if you do not know much about the Postner-Schlossman syndrome, by the diagnosis of exclusion, you are actually reaching to your answer without any confusion. So this is a small initiative from our side to give you a practice about the NEET pattern 2021 questions, because you will have more and more clinical questions in an integrated fashion. So I hope this video is helping you. Please do like the video. Please give your feedbacks. We always look forward to see your feedbacks, your comments. How do you like it? And it definitely gives us motivation to bring the daily videos in front of you. Thank you and happy ophthalmology.